Another component of carotid sheath is the internal jugular vein. Internal jugular vein actually is the continuation of sigmoid sinus in the skull. After that, it passes from jugular foramen and enter the neck and enter the carotid sheath. Inferior part of the neck, the internal jugular vein joins to subclavian vein and form the brachiocephalic vein. Jugular vein is located in carotid sheath as lateral to artery, and it has a superior and inferior bulb. Superior bulb is located near the jugular foramen. Inferior bulb is located near termination. Placement near the inferior part of the neck when the jugular vein joins to subclavian vein. This is the internal jugular vein. In this picture, you can see blood collection or received different vein from the face and neck. For example, superior thyroid vein drain to internal jugular vein, middle thyroid vein drain to internal jugular vein, and facial vein, lingual vein, pharyngeal vein, occipital vein drain to internal jugular vein. This is very, very important. You know about blood drainage in the neck and internal jugular vein. Another component in the carotid sheath is the vagus nerve. Vagus nerve is located in carotid sheath behind the internal jugular vein and common carotid artery, and it's lie between the vein and artery. The vagus nerve passes from jugular foramen and enter the neck. In the neck has different branches. For example, cardiac branch is here, raised from vagus nerve and goes to mediastinum and form the superficial cardiac plexus. It has a pharyngeal branch. Goes to pharynx and with the glossopharyngeal nerve, the pharyngeal plexus. It has carotid branch is here, goes to carotid, and it has a superior laryngeal nerve. This one. This is the superior laryngeal nerve. Superior laryngeal nerve is divided to internal and external branch. External branch has a motor fiber and goes to cricothyroid muscle, actually innervated the cricothyroid muscle. But the internal branch has a sensory fiber and passes from thyroid membrane and enter the internal cells of larynx and provide sensation for upper part of larynx. This is the vagus nerve, right and left vagus nerve. In the thorax, the vagus nerve has a recurrent laryngeal nerve here. the left recurrent laryngeal nerve near the aortic arch, raise from vagus nerve and turn to upward. Passes between the groove, in the groove between esophagus and trachea, and come back to the neck. But in the right side, this is the right vagus nerve, and this is the right recurrent laryngeal nerve. Raise from vagus nerve and near the subclavian artery, turn to upward and come back to the neck. So initiation of left and right recurrent laryngeal nerve are different in the left side and right side. Another structure is located in the neck, the glossopharyngeal nerve, this one. The pharyngeal nerve has a different branches, for example, pharyngeal branch, carotid body and carotid sinus branch, or actually it has a branch for carotid sinus. And the main stylopharyngeus is a motor and goes to stylopharyngeus muscles, innervated the stylopharyngeal muscles. This is the hypoglossal nerve, passes in the neck. Hypoglossal nerve exit from a skull, from hypoglossal canal. After that, in the neck, cross with the occipital artery 2 times. This is the hypoglossal cross with the occipital artery in 2 times. And the finally hypoglossal nerve innervated the lingual muscles, except the palatoglossus muscles. This is the accessory nerve, exit from jugular foramen from the skull. After that, innervated the CM muscles to posterior triangle muscles. Finally, innervated the trapezius muscles. This is the direction of accessory nerve. In triangular, posterior triangle, the accessory nerve passes levator scapular muscles. This is the levator scapular muscles, and this is another structure is located in the neck, and it's very, very important. It's a subclavian artery. Subclavian artery is different on the left side and right side because the left subclavian artery rays from aortic arch directly, but the right subclavian artery rays from brachiocephalic artery on the right side, and it has a 3 part: first part, second part, and third part. Because subclavian artery passes posterior to anterior scalene muscles and is divided to first part, second part, and third part. This is the first part of subclavian artery, has 3 branches: vertebral artery, internal thoracic artery, and thyrocervical artery. This is the first part, internal thoracic artery, vertebral artery, and thyrocervical artery. Vertebral artery is the first part of subclavian artery and go upward, enter the transverse foramina in cervical vertebra. Finally, enter to a skull from foramen magnum. This is the internal thoracic artery, raised first part of subclavian artery, goes to posterior to first cartilage and travel downward. And this one is thyrocervical trunk. This is the vertebral artery. This one. Vertebral artery passes from foramen magnum in the skull, and in the skull, and right vertebral artery join together and basilar artery. This is the internal thoracic artery, raised from first part of subclavian artery. After that, travel downward, posterior to costal cartilage, and in the 6 intercostal space has two anterior intercostal arteries in each space. And finally, near the 6 intercostal cartilage is divided to terminal branch, superior epigastric artery and musculophrenic artery. Musculophrenic artery is here, goes to lower intercostal space, has an intercostal artery, but the superior epigastric artery goes to abdomen, actually enter the rectus sheath in the abdomen and supply the abdominal wall. The third first part of subclavian is thyrocervical trunk is here. Thyrocervical trunk is near 1 centimeter long and immediately is divided 3 branch: inferior thyroid artery, transverse artery, and suprascapular artery. Suprascapular artery here, this one, goes to area, and transverse cervical artery supply the neck, and transverse cervical artery is divided to superficial and deep branch. Superficial branch supply the trapezius, but the deep branch supply the rhomboid muscles, minor and major rhomboid muscles. Let's look at the inferior thyroid arteries here. Inferior thyroid artery goes to, this is the thyroid gland, to posterior part of thyroid gland and supply lower part of thyroid gland with suprothyroid artery, and it has a smaller branch, this one, as an ascending cervical artery. Ascending cervical artery travel upward and supply the cervical muscles. Second part of subclavian artery has the costocervical branch, and third part of subclavian artery has a dorsal scapular artery. But the costocervical is different in the right side and left side. This picture, I think this picture is better. Yes. This is the left side and this one is the right side. Costocervical branch in the right side raises second part of subclavian artery, but the costocervical in the left side raise from first part of subclavian artery. This is the very important point. And the costocervical trunk in the right raise from second part, but on the left side raise from first part. This is the costocervical trunk. It's divided to deep cervical branch and superior or supreme intercostal branch. Supreme or superior intercostal branch goes to first and second intercostal space and provide the posterior intercostal artery for first and second intercostal space. But the deep cervical artery travel upward and goes to cervical muscles. This is the thyrocervical artery from the first part of subclavian, divided to inferior thyroid, transverse cervical, and suprascapular branch. Finally, please look at the third part of subclavian artery. From the third part, there is one branch as a dorsal scapula. The dorsal scapular artery is from the third part and goes to dorsal part of scapula. This is the phrenic nerve. The component is passes in the neck. It passes anterior to anterior scalene muscles, and the phrenic nerve is formed by C3, 4, and C5 spinal nerve, and it has a motor fiber for diaphragm muscles, and the phrenic nerve in this direction cross with transverse cervical and cross with suprascapular artery. It's very important. It's crossed with two arteries, transverse cervical and suprascapular artery. Do you have a question about subclavian artery? Okay. There are sympathetic chain near the ribs and vertebra in the thoracic and cervical part. The sympathetic chain contains up to ganglion, but there are three ganglion in the neck: superior ganglion, middle cervical ganglion, and inferior cervical ganglion. The superior cervical ganglion is located near the first vertebra, first cervical vertebra. The middle cervical ganglion is located near the C6, and the inferior cervical ganglion is located near the C7 and T1. Superior cervical ganglion has different branches, for example, a cardiac branch, a spinal branch, branch for carotid body, carotid sinus, and branch for carotid artery. But the middle and inferior ganglion has just spinal branch and cardiac branch. And then finally, lymphatic drainage is drained to 5 nodes: occipital node, mastoid node, node or preauricular node, submandibular and sublingual nodes. Occipital and mastoid drain to superficial node, but the parotid, submandibular and sublingual node to deep node. You know there are several nodes around external jugular and internal jugular vein as superficial and deep node. Another component in the neck is a brachial plexus. Brachial plexus formed by C5, C6, C7, C8, and T1, and it has a trunk and cord in upper extremity or upper limb. You study about the branch of brachial plexus, but C5 and C6 join together and form the upper trunk. C7 form the middle, and C8 and T1 join together and form the lower trunk. After that, the upper, middle, and lower trunk divided to anterior and posterior ramus. Posterior ramus join together and form the posterior cord. Anterior branch of upper and middle trunk forms the lateral cord, and anterior branch of lower trunk medial cord. And after that, there are different nerves, for example, radial, axillary nerve, ulnar nerve, median nerve, raised from lateral, posterior, and medial cord of brachial plexus. The final subject for today is gland. Thyroid gland is located in the neck, deeper to sternohyoid and sternothyroid muscles, and is related to tracheal carotid sheath, and is located in the neck at level of C5 to T1. Thyroid gland has a 2 lobe, right and left lobe or lateral lobe. Lateral join together at the midline and forms the isthmus. This is the isthmus part. Isthmus part is located anterior to second and third tracheal ring. It's very, very important. You should know about the isthmus relationship with the second and third tracheal ring. The thyroid gland supplied by superior thyroid artery, erased from external carotid artery, and supply with the inferior thyroid artery, erased from subclavian artery. Actually, superior part of thyroid gland supplied by superior thyroid, inferior or lower part of thyroid gland supplied by inferior thyroid artery. But there are three veins in thyroid gland: superior thyroid vein, middle thyroid vein, and inferior thyroid vein. Please look at this picture. Superior thyroid vein and middle thyroid vein drain to internal jugular vein, but the inferior thyroid vein to brachiocephalic vein. Internal jugular vein join to subclavian vein and produce brachiocephalic vein in each side. This is the left brachiocephalic vein, and this one is right brachiocephalic. After that, the right and left brachiocephalic vein join together and forms the SV, superior vena cava, or SVC. There are 4 parathyroid glands located posterior to thyroid gland. This is the superior parathyroid, and this one is inferior parathyroid gland. Produce parathormone hormone, and parathyroid gland supplied by superior and inferior thyroid artery. This is the thyroid gland. Thyroid gland. Posterior surface of thyroid gland is related to recurrent laryngeal nerve. This is a recurrent laryngeal nerve. Some patient needs to thyroidectomy for remove the thyroid gland. The surgeon be careful, because relationship of thyroid gland with the recurrent laryngeal nerve. If the recurrent laryngeal nerve damage, the patient can't speak because the recurrent laryngeal nerve innervated the larynx and vocal cord. Okay, please look at some video for external carotid artery, subclavian, and internal jugular vein. I share my screen of laptop.
On each side, 2 major arteries, the common carotid and the subclavian, emerge through the opening at the top of the chest, the superior thoracic aperture. To see them, we'll look at a dissection in which we've already removed the overlying structures: the sternocleidomastoid muscle, infrahyoid muscles, and internal jugular vein. Here's the clavicle. The first rib is here through the opening at the top of the chest, the superior thoracic